It is all hands on deck at the University of Minnesota in the fight against the COVID-19 pandemic.
They're working on everything from life-saving medical equipment to potential treatments and quicker tests for the disease.
The team here at the U of M is actually repurposing an immunotherapy or living cells.
This could be the early start of a paradigm shift.
The University of Minnesota has been at the forefront.
In many ways, the trauma and risk is similar to a combat zone. The battle buddy idea could work along these front lines as well.
We've really relied on our own internal resources to get this done.
We're developing a vaccine that's based on T lymphocytes that can kill virally infected cells.
I am the most proud of the people that step up and work together.
Hello and welcome. My name is Joan Gabel and I'm the president of the University of Minnesota. It's an absolute pleasure to be with you today. Thanks to all of you for joining us virtually. I hope you're all healthy, safe, and well in these very interesting times. You may be pleased to know that we have over 7,000 alumni and stakeholders and friends registered today, representing 47 states and 19 countries. We've received over 1,000 questions in advance, and we read through every single one of them. And we pulled them together into similar themes on topics that many of you were interested in. So joining me today is someone who needs no introduction. He is a 3-time alum and has served on our faculty since 1976. In fact, I just learned that he has served under 7 of our 17 presidents. He is a Regents Professor, McKnight Presidential Endowed Chair in Public Health, the Director of the Center for Infectious Disease Research and Policy, many of us know that as CIDRAP, Distinguished Teaching Professor in the Division of Environmental Health Sciences, School of Public Health, a Professor in the Technological Leadership Institute, College of Science and Engineering, and an Adjunct Professor in the Medical School, all at the University of Minnesota. He is the leading expert for measured and accurate information about the pandemic, helping Americans across the country safely adapt to this new normal. And he is also a proud Gopher parent with a med school daughter who now serves as the medical director to the U's Masonic Children's Hospital, and a son who graduated from the university's law school. So of course, I am talking about Dr. Mike Osterholm. Welcome, Mike. Thank you.
Thank you very much, President Gabel.
My absolute pleasure. So we know you've been on faculty for quite some time, but I think it might be interesting given who's listening. We've all seen you on the news sharing your expertise about the pandemic, but you are a Gopher true and true. Can you just tell us a little bit about that?
Well, I am very proud to say that I have been affiliated, as you pointed out, nonstop since I started as a student in 1975. And back then, that infectious diseases were considered over and done. In fact, there were many people that questioned why I'd want to go into a horse and buggy discipline and not get on with the really important health issues of life. And so ironically, because of the shortage of infectious disease expertise in academic centers around the country at that time, I went from kind of what one would say in a surgical residency, see one, do one, teach one. And by 1976, I was actually teaching in the program and taking on graduate students by 1978. I also started simultaneously, something I would not recommend anyone else to do, but I started full-time at the Minnesota Department of Health in those first months that I also started graduate school, and I did both for 5 years as I earned my 2 masters and PhD. I probably wouldn't recommend that again to try to double load that. But nonetheless, it was a wonderful bridge, and it really served for what our model is today, where the Minnesota Department of Health is really one of the finest academic health, public health agencies in the country. And we in turn have access to that for our students. And so to me, this has been a real labor of love and labor of opportunity. I would just say finally that having my kids graduate from the University of Minnesota, my daughter is a medical director at the NICU. My son, a lawyer there who has now become one of the finest foodborne disease litigation lawyers in the country, makes me very, very proud to be part of the Gopher tradition.
I'm sure you are very proud of them. And of course, we are very proud of you and have been for a long time. But recently, it has been tremendous to see how you've guided the entire country with your expertise. And many people are particularly excited and send congratulations on your selection to President-elect Biden's COVID task force. So in terms of the country and COVID and the task force, can you give us an update?
Well, let me just say that these are the best of times and the worst of times. It's the best of times in that we actually have on the horizon effective vaccines that will fundamentally change what this pandemic will look like a year from now, if in fact we as a society accept those vaccines and take them. And so this will be our challenge to see what we can do. We also have a challenge globally, because if this virus is circulating widely in low and middle income countries that don't have immediate access to vaccines, that virus will continue to leak back into this country and cause us problems. So we really are all about an international effort right now that isn't just a function of altruism. It's also very much a function of our own public health issues. So I think that's exciting. The dangerous situation ahead of us right now is we literally are in the most dangerous public health moment since 1918 in the swine flu pandemic. Right now, what we're seeing globally is a house on fire kind of issue here in the United States. Yesterday, we reported over 183,000 new cases. We had days this past week over 200,000 cases. Just remind everyone, back in April, when we thought it was as bad as it was going to get in the minds of many, we were at 32,000 cases a day. Yesterday, we had almost 2,800 deaths reported in this country. That now puts this as the number one cause of death per day in the United States as we're seeing these numbers. And then finally, we have almost 100,000 individuals hospitalized right now with this infection, which is literally causing many of our healthcare systems to verge on collapse. They just can't provide more care. We don't have the healthcare workers to do that. And unless we change our risk profiles, in other words, stop swapping air with our friends and colleagues out there that aren't being bubbled up with us, that are potentially exposing themselves in any number of social settings, this is going to get worse. I worry desperately over the course of the next 5 to 10 days when we watch what will happen with our number of cases and hospitalizations following Thanksgiving, where we had many individuals who didn't abide by the recommendations not to get together with others. And we're slinging shot into the Christmas holiday season. So before things are going to get better, and they are going to get better, we are living in this very dangerous time. And the painful part of it for me is that so much of it's in our control. We as humans could limit this risk if we so desired or so believed it was that important. And if we don't, I just can only say that these are going to be really the darkest days of this pandemic over the course of the upcoming weeks to months.
Well, I do know by you carrying the mantle on that, we are as likely as we could possibly be to see the other side of this in hopefully a less damaging way than what you've described. So let's talk for a minute about the other side of this. You referred earlier to the vaccine, and we're hearing a lot of different news, a lot of different versions of the vaccine, and people are starting to wonder, what is it actually like to confirm the availability and success of a vaccine like this and then distribute that? Can you tell the average person what their experience might be like in terms of when or how they would receive access to the vaccine?
Well, that is still a plan that's in process and progress. Each state will decide how the vaccines will be rolled out within the context of national recommendations. Yesterday, we saw for the first time the Centers for Disease Control and Prevention Advisory Committee Immunization Practices did kind of just the first easy cut of who would be in the priority group: healthcare workers and those in long-term care facilities. And that will basically be a group that will take up most of the vaccine that will arrive in the United States or be produced here between now and early January. But after that, we really have to get into then how else do we allocate this vaccine in terms of work areas, essential workers. The racial disparities with this have been enormous. How do we account for that and make certain that we're reaching those communities that have been hardest hit? And in the end, it's all about how are we going to get people to take the vaccine. Right now, we have survey data from around the country that suggest up to 45% across the board are very skeptical of the safety of this vaccine. And in some of the Black, Indigenous, and communities of color populations, that number is as high as 75%. So we have a major task ahead of us of helping people understand how these vaccines were made, what they were made from, why we believe they're effective and safe, and why they are the game changer for us with this pandemic. So we've got a lot of work cut out for us, and this is where public health and messaging is going to be really very, very important.
That makes perfect sense. So let's fast forward to the day when the vaccine exists, we've taken it, and we've seen the positive effects on our society. You talked for literally decades about the risk of a pandemic. In fact, one of our colleagues remarked to both of us that you prepared your entire life for this moment and have now the ability to have an enormous impact that we're all feeling. What is the next? Do we just go back to normal from a public health point of view, or do we have remaining risks that we should be mindful of?
Well, there are two kinds of risk here that we're dealing with. One is the actual physical risk of, will we continue to see this virus circulate in our population? And the answer is absolutely yes, depending on how many people are vaccinated and can we really knock down the activity to the point of where it becomes a rare phenomenon. The second risk we have is one that is much more difficult to describe, but nonetheless, I think equally important. What has that done to our mental health? What has that done to the psychology of us as a population? What do we think of in open spaces? What do we think of in closed spaces, indoor air? How do we travel? What kinds of modes of travel do we feel safe in? At what point will we find it completely acceptable and appropriate not to talk about masking anymore? Will we want to sit next to someone in a crowded theater? And what will that mean? And so I think we have a lot of work to do to understand, one, what we must do from a public health standpoint to reduce the actual occurrence of disease. And number two, what we must do so that people move forward in terms of how we interact in public and private spaces. Let me just remind people, after 9/11, we've never flown in an airplane the same way again. It's a new normal. And I think we will have a new normal with air. And as I pointed out in the beginning of this session, swapping air. We got to stop doing that. We don't want to swap body fluids. Why are we swapping air? And however we can, what can we do to make that happen? Whether it's through building design, transportation design, how we get together. Will we feel comfortable, hundreds of people packed in a bar, celebrating the Gophers' victory at the Rose Bowl? I mean, what are we going to do? How are we going to handle that? And I think that's what I still am unsure of how we're going to, as a society, respond.
Well, I like the idea of part of that social response, including a Rose Bowl victory. I'm sure there were 7,000 cheers heard around the world when you said that. But let's talk about campus life and higher education, something that you and I, in addition to your work in science, have committed our entire lives to, and that everyone listening cares about so much. Both of us were asked and received the question about what we think the future of higher education is. I have my thoughts on what it means from a learning and research environment, and I'll share those. But once I do, I would be very interested to hear your thoughts on what it will be like to be together in a community like this that has been so reliant on togetherness. And I do think that's where a lot of the future opportunity is that we've always done things almost entirely the same way. And that's not to say that we haven't been agile or innovative when circumstances allowed. But if you think of the core physicality of being on a university campus, a group of people huddled over a microscope, a group of students sitting attentively, hopefully, while the professor speaks to them or while they work together around the table, exploring a scientific question, a piece of art, a piece of literature, etc. And we assumed when all of this started that this was that moment when the entire campus experience would be so fundamentally disrupted that the advent of online education would really truly take over in the ways that people had been warning us of for literally decades now. One of the things that I saw as a higher education administrator and also as the parent of college-age children was that the one thing that became really apparent was people desperately wanted to be on campus. They really wanted the connectivity and the fact that we're able to deliver content through Zoom or whatever platform different people use was not a substitute for the real dimensionality of what it is that happens while you're a university student. So I'm quite confident that when it's safe to do so, we will return to a version of campus life that will have a lot in common, perhaps not identical, but a lot in common with what we had before. But I also think that we've had this disruption in our appetite to do things over Zoom that we never could have imagined, or to do things in a distributed way that we never could have imagined. The way that we're appreciating art, the way we watch movies, the things that you gave as examples where we may feel the highest sense of risk, we've also developed a sort of trust in this tool and in our ability to participate in life in this way. And I think that will affect us on campus too. There are jobs that people will do from home. There are classes that people will take from home. And that opens things up for us in a way that probably was unimaginable for us before. It was piecemeal before. It could be strategic and programmatic now. So I think, and maybe I'm, at Pollyanna's table for one, that we're going to get the best of both worlds out of all of this, that we're going to have campus life and all of its beauty and personal development, educational maturity. And we're also going to have the ability to distribute what we do in new ways with open appetites for receiving it in that way. But I wonder how that strikes you as a professor, as public health expert, as the parent of former students, what your thoughts on that are.
Well, I think you said it very, very well. Let me just remind everyone here that I've been saying for months, we're living in our COVID year. It's not like last year. It won't be. And we want very much not to have it ever happen again, like it might next year, in which we are back to that new normal of being together. And so just understand this is the COVID year that we're learning from and that we are vowed to not have to repeat. I would also say that I think, and I think you really hit on this, is that the University of Minnesota is much more than a bunch of buildings. It's much more than, just one individual. It's a community. And, I, having been here since 1975, 45 years, have always appreciated the University of Minnesota as my academic home and as a very special place. But I didn't ever appreciate it nearly as much as I do today. It's my community, I can't tell you how much I miss the people I work with. I've not seen them since March. That's hard. And so I think we do understand that the university is much more than a name, than a bunch of buildings, that it is something very special. It is community. And while we learn in community, we learn to live in community too. And I think from that standpoint, I do have every hope that we will come back and we will actually appreciate even more what some of us took for granted in terms of community. And so I fully support you. We owe it to those who have suffered in this pandemic, those who have died and their families, to get the lessons learned from it and apply them to the future so that, one, this doesn't happen again, and number two, wherever we can find that silver lining in a very, very dark cloud, that we make sure we don't miss that opportunity to live that silver lining.
I totally agree. I have to tell everyone a little story. So we had to cancel commencement, as everyone knows, last spring, which, as you can imagine, was one of the hardest decisions we had to make through all of this, and also devastating for many of our students, faculty, and staff. And we pivoted quickly to do a virtual commencement. And the way we handled that was, instead of having a typical single commencement speaker, we had a group of speakers to represent the different constituencies who might be interested in watching. And Mike was our speaker as an alum, actually, not just as a scholar, not just as a public figure in these crazy times that we find ourselves in, but as such a tried and true bleeding maroon and gold gopher. And so in order to film that, we had to do that outside because of the circumstances that we were in. So Mike and I filmed on the same day, and we were sort of, when you talk about seeing your colleagues, we sort of orbited around each other from 6 feet apart, and how nice it was to literally physically see each other, but also bittersweet. It has been a time when many of us have suffered, and in ways that were unimaginable. For many of the families, and the number of lives lost is an utter and almost timeless tragedy. And yet there are a lot of personal tolls that have been the case for many of us, the stress and anxiety. As a former business school dean, we say markets can handle good news or bad news, but what they can't handle is uncertainty. And we as individuals are not a market, but that you can feel the impact of the uncertainty and the isolation and what it's done. What do you think, as a matter of personal life coping? I can't imagine anyone whose professional life changed more during this period of time than you. Do you have advice for any of us on how you find your own time, how you stay so motivated and active during this incredibly grueling run that you're in?
Well, before I comment on that, let me just say, I think most of the people on this webcam probably realize that I've spent my entire life calling balls and strikes, not always to everyone's liking and not always popular. But I just want to make one really important statement here. You know, President Gabel, I have had the opportunity to serve with 7 college presidents and have appreciated incredible support across all of my history here at the university. But I just have to tell you, I am so proud to be part of this university under your leadership. What you've done over the last year has been an impossible task. And I just want to thank you. And I think I speak for many, many people for keeping us together, for keeping it together, and for providing that positive leadership in a time of very dark clouds. So before I move on, I just want to say thank you for that. It has been inspiring, and gosh knows it's been critical. In terms of my life, you know, maybe some of you also know on this, you know, I'm an old English Channel swimmer. People who are always wondering if everything was up in that upper part of my head, you know, swimming for 40 miles at a crack in icy cold water. You know, and when you're a channel swimmer, you realize when you're really hurting in the 4th mile and you still have, you know, many more to go, you just understand how to adapt mentally and physically. And I think this past year has been that. You know, on January 20th, I put out a document saying that this was going to be our next pandemic, and it was coming 2 months before the WHO did. And I think we saw it at the time, what was going to happen. The one thing that we hadn't anticipated, nor did I, was the fact that unlike the influenza pandemics of past, like 1918, the average period that a community was really under threat from the influenza virus was only 6 to 10 weeks. We're now in our 11th month. And so the idea of pandemic fatigue and even pandemic anger based on top of the political issues we have today, this has been hard to deal with. And if there's any empathy I have with everyone out there who is suffering, is the mental health aspects of this pandemic as well as the physical aspects. This is taking a toll on us. As humans, we have not in the past had to deal with this kind of long-term pandemic, not since dating back to the Middle Ages and plague, where it could last for a year or two as it swept through Europe. So I think that this has been a real challenge. And so for me, I've just had to understand, you know, we're still in this, we're in it now, and we're going to be in it for a while yet. And just that's the focus we have to have. I just put my eyes on that far, far shore and know that I'm not done till I get there.
It is a long game, without question. So that actually brings me to our next question, which is from our mutual friend, Lori Benson-Kauth, who I'm sure is watching us on the West Coast. So she has asked a question that many people ask, which is sort of a more immediate question. We just had Thanksgiving, and we're about to have the next set of holidays. What advice do you have for people in how they could be with their families, what they can do that is safe, and what their short-term decision-making should look like?
Well, thank you, Lori. And let me just please make a footnote here that the reason our center was able to respond on December 31st of last year to begin covering this pandemic was the fact that we have enjoyed for the past 8 years unrestricted support from the Benson Foundation to do what we thought was really important. That's rare to find that kind of unrestricted support. And it was singularly because of the Benson Foundation that we basically were able to shift our priorities on a dime and begin covering that pandemic extensively in the very, very earliest hours of it. So thank you to you, Lori, and to the members of the foundation, Judy Dutcher, the board. You're an example of why you help make Minnesota so great. In terms of the question, I live it every day in terms of just how can we get together? What does it mean for students? Again, I come back to the fact if you're swapping air with someone else who is swapping air with someone else who is swapping air with someone else, you run the risk of being infected and actually taking that virus home with you. I have seen personally far too many tragic situations when a young, healthy student, basically unaware that they're infected, goes home for a family event of some kind, some social event, and mom and dad or grandpa and grandma get infected, and 2 to 3 weeks later, they are dead. That's such a tragedy. So please think about just that casual visit, that last minute thought. I know we all want to be with family right now. I know that that's hard. My worst nightmare coming ahead of me personally is for the last 38 years, I have read the Polar Express to my kids as young children right into their adulthood. And when I've had the 5 grandchildren that I so appreciate today and have not been able to be with, this is the first year in 38 years I won't be able to read in person the Polar Express on Christmas Eve. Now, there are ways, of course, that you can actually handle this if you're a student, if you can bubble yourself up for at least 5 to 7 days minimum, and you're tested in that time period so that by the time the 7th to 10th day shows up and you're negative, then, go for it. Go home. Love your parents. Love your grandparents. But if you can't do that, please don't put them at risk. Find ways to be creative. And I just come back to one last message. This is our COVID year. This is a year of love that sometimes is not manifest in the usual way. Sometimes being absent is the greatest love of all. So I would just urge you at this point to think about how you can come home safely, how you can protect those in your family, how other members of your family must do the same thing, and how tough that can be. So go for it, but only if you can do it safely.
That's great advice. I want to come back to something you mentioned in your last answer, which is CIDRAP, which has existed for a long time with tremendous support, including the support of the Benson Foundation, which we're so grateful for. But a lot of people listening have gotten to know you and your work because we're in the COVID year. But actually, as you referred to earlier, you've been doing this for quite some time, and that work has really coalesced through the center. Can you tell us about what the center does? Because it's much more than the pandemic.
Well, first of all, the center is by itself the most amazing group of people that I could ever imagine working for. The senior leadership of the center includes 2 of the most wonderful professionals that I could ever imagine working with, Jill DeBoer and Chris Moore, who we've now been together over 35 years as a team. They were with me at the health department, came with us here to the university when we moved and started CIDRAP. And one of the things that CIDRAP is about is bringing together the best and the brightest. And that's what we have there. And we tackle issues from pandemics to antibiotic resistance to making sure that we have flu vaccines in the future that will stop future pandemics from occurring. We have the most amazing news team. We have a highly celebrated news team. Our coverage is literally followed around the world. And we also have an educational opportunity. Many students pass through CIDRAP. We teach classes where we try to bring everyday practical life to the students. As an example, my class from last spring, which unfortunately was impacted severely by the emerging COVID epidemic, the first day of class was that day that I said that this was going to be a pandemic. And that's how the students started their first 10 minutes of class, me telling them we had a pandemic coming. Well, when classes were actually taken online, off campus in March, I continued, of course, teaching online. But you know what? This was such a special group of students. We've only missed 1 or 2 Mondays since last March. Meeting every day. We meet every Monday. We just met this Monday. And, that's what CIDRAP's about. It's about basically creating an experience that's more than just classes. It's more than just, putting out publications. It's about training the future and it's about living the future now. And so I'm extremely proud of the people I work with at CIDRAP. You know, I get a lot of credit for what goes on there, but just I remind people there is no I in team. There is none. And I think that's what makes CIDRAP so very special. And I want to also say we've had incredible support from the university. You know, I've worked for two different deans in the School of Public Health, Mark Becker, John Finnegan, and I work now with Chris Kramer in the Office of Vice President of Research, and we've had incredible support in the university doing what we do. You know, we are often out there on the edge, and you have maintained your support in a way that I can never adequately repay back to the university.
Well, I should mention for everybody that that's absolutely a two-way street, because anything that we've done right as a university leadership team through this pandemic in order to maintain safety while continuing to do teaching, research, and service, we did with a leadership team that included Jill DeBoer and the other members of the CIDRAP team that Mike just referred to, who have been not only doing the work of CIDRAP, but sitting in our meetings, slogging through the thousands of small decisions that come together into an emergency management plan that takes a large, gnarly, tens of thousands of people, complicated institution through a time like this. So that support, it absolutely goes two ways, and we're extremely grateful. So a follow-up question to what you just said, and something that I think many of us are curious about. The work that we're doing right now around COVID is remarkable. And I think even those of us who have no scientific expertise in this area appreciate how quickly the vaccine has come on board. What might this mean for things like the flu or even the common cold?
Well, people are now recognizing it's a lot cheaper to prevent these situations from happening than have to respond to them. And the one, you know, magical tool that we have in public health has been vaccines. You know, it's taken us from that era where, you know, average life expectancy was 40 years at the turn of the into the 20th century, and what we now are able to enjoy today. That's not always true around all the rest of the world, where sometimes vaccines are absent, safe water is not there. But I think today that the vaccine issue is really taken on a whole new dimension of importance. People realize, wouldn't it be something if we could take coronavirus pandemics off the table? What if we could take influenza pandemics off the table because of new and improved vaccines for the world? What if we could actually vaccinate ourselves against those common microbes that cause antibiotic-resistant infections, those infections for which we have very few, if any, antibiotics to use today to treat these individuals? So I think you're going to see a renaissance in vaccines over the course of the next years, and you know, we're going to try to be right there with it. Our group right now, led under the very capable auspices of Dr. Chris Moore, are chairing and supporting a major effort that includes the World Health Organization, the Wellcome Trust, the Gates Foundation, and others to actually develop game-changing influenza vaccines that what if they could be given once every so many years and protect against the new emerging strains. So we'll continue to work on that. And of course, we'll continue to work on coronavirus infections. This is not the last one. And, you know, and I look at the influenza world right now, this one is not even the big one, meaning that if we were to have another 1918-like pandemic, which surely could happen, that would even be much more severe in our society in terms of impact and deaths than what we're seeing now with the coronavirus. We don't want that. God knows we don't want that. So our job is to make sure we prevent it from ever happening.
No, we absolutely don't want that. So let's talk for a minute. You mentioned the World Health Organization, about how this played out differently around the world, that there was a lot of difference in experience, some commonalities, of course, with different responses in different countries. And we've received questions about lessons we might learn from capturing the global perspective and taking and cherry picking some of those lessons. Can you share some of your thoughts on that?
Well, you know, there really have been kind of three models that have been employed in terms of responding to this. First of all of us around the world were caught in those earliest days of this pandemic with kind of a relatively thin playbook. How do you handle a coronavirus infection? What does it mean? And with that, we saw these very large outbreaks that occurred in Asia, in the Americas, and in Europe. And the Asian countries, China noted, really had very vigorous response. Some would argue that they were part of an authoritarian government approach where people were literally mandated to stay in their homes for weeks and weeks at a time with only limited opportunity to go even to the grocery store. And they brought the case numbers down. And since that time, with very aggressive follow-up and testing and contact tracing, they've actually kept it well under control. Others would say, well, that's an authoritarian government. That's not going to ever work here. I'd remind people that in Asia also, New Zealand and Australia, while both being island countries, also had substantial challenges with this virus, but they became very active and they basically brought the public in on the response where they paid people to get tested. They actually paid people to be quarantined, and they had very, very vigorous follow-up early on and have pretty much maintained this much lower level of virus activity and have gotten back to generally what we would think of as a more normal life. The European countries also had their houses on fire early, clamped down hard initially, really drove the case numbers down, and then did much the same thing that the Asian countries did, with one exception. When it got to August, they said, well, we're kind of tired with this virus. We've done everything. It seems like it's okay. And then they let up the brake far too fast, and you saw what happened. They became a house on fire also, rivaling anything that we saw here. And they're still dealing with it primarily in Eastern Europe, where they have had that term lockdown, a term I absolutely despise. That I feel like I'm drinking barbed wire when I say that word. And it's a very real challenge, but they're bringing it back under control. We in this country never really did any of that. We claimed we had a lockdown in the spring. And yet we can show that in many areas where the idea of essential workers made up about 38% of the workforce, yet 75% of the workforce still went to work every day. And we went from 32,000 cases a day in April, as I talked about, to 22,000 cases a day. At Memorial Day, we began to see pandemic fatigue set in. We got to 70,000 cases a day in July. And in some states, Florida, Georgia, Texas, Arizona, and California, particularly hard hit. And then again, we clamped down a bit. But then with Labor Day, with the confluence of what we saw with pandemic fatigue, people who believed the pandemic were real, but they were just done with the virus, even though the virus wasn't done with those individuals. And then the pandemic anger, a category I have labeled that, people who didn't believe the pandemic was real, that it was all a part of a political ploy to have an influence on an election. Then you add that all together with indoor air, and meaning that the virus is transmitted more readily where it's not rapidly exhausted away from you like it is outdoors. And we've really hit a point right now in this country where I don't know where the ceiling is going to be. In August, I predicted that we'd be at 200,000 cases a day by Thanksgiving. Unfortunately, we hit that. I don't know where the next one's going to be. It's up to us. It's up to us. So I think to say how the rest of the world did, the Asian countries provided us a roadmap. The European countries provided us a roadmap and then an example of what not to do. And we have pretty much been a country of not what to do. And at some point, I hope that we can bring these case numbers down. As much as we talk about cases, I mean, you and I have talked about this before. These are real people. These are our loved ones. These are not numbers. These are family members. These are colleagues. And to see any more of these people ill and die is just tough. So it's up to us. And I hope we create a new model that's more like the Asian model and that we glide into the vaccine era without having to do it in the middle of a huge crisis.
I hope so too. So a lot of the people who are with us right now are alums of the university and feel not just this desire to fulfill your call that it's up to us, but to do so in a way that reflects their pride in your work, their pride in the university, their pride in what the university has done as part of the solution in the resolution of the pandemic, much of which we all saw on the video at the beginning of our time together. What specifically do you think we can do as the University of Minnesota community in order to be part of that "it's up to us" solution?
I wish I could have some wise words that sound very prophetic and and, this is the way. I think the university has done a remarkable job. I think that if you look across the board at all the different departments and schools that have brought together resources, have been creative, I think how we've handled the difficult situations when everybody has an answer until it's wrong, and then they forget that they had it. And I think that we've had to weather unknowns. What would happen with transmission on our campuses if students came back? How do you deal with athletics when we know that that is a major part of our school experience for some people? How do you protect the health and safety of aging professors like me who may have underlying health conditions that predispose them to serious disease? How do we make sure that students are safe? Well, we can't guarantee safe. We can guarantee safer. How do we do that? And so I think, as hard as it's been, I think you've kind of threaded the semi through the needle. It's been tough. And all I can say is I can't wait until next year, because at that point, I do have this belief that the vaccines are going to fundamentally change the entire discussion, going to bring us back in a much safer environment. We will appreciate our presence on campus like we have never appreciated it before. And I think the rest of the university just keep doing what we're doing. I'm so proud to be colleagues and friends with so many people who have done so much. I just want to add one additional note. Healthcare workers don't go into their job to be called heroes. In fact, it may seem somewhat as if it puts undue pressure on them. But what our university doctors and nurses and respiratory therapists and laboratorians and station clerks and all these people have done to deal with this pandemic is absolutely amazing. It's such a heartwarming story, and at the same time, it's hard to talk about because you see the pain that they go through every day trying to deal with this. And so, I think if there is one area at the university, I hope people understand it's what our doctors, nurses, and medical teams have done. It's been remarkable, absolutely remarkable.
I have to second that. And I'll share with everybody a couple of things, a couple of reactions to that, if I can just have a little indulgence. So, where Mike has been with the university since the 70s, I've been here 18 months. In fact, on November 1st, I just passed the halfway mark of my short presidency with longer periods of time running the university the way you all see me right now than I did from my office in Morrill Hall, which is kind of a crazy factoid, but true. And what I have seen, even in this short time, and with still some objectivity, having points of comparison from previous life experiences, is exactly as you describe in terms of how the community has pulled together, even when we can't do so in person, virtually, and through the professional life of our faculty and staff and our frontline workers. Over 70% of clinicians in Minnesota were trained on this campus or on our campuses. And you see that set of values and that spirit and that esprit de corps represented in how we provide that clinical care. I'm sure your daughter being absolutely the ambassador and champion of that level and quality of work, along with so many others to whom we're so grateful. But I also want to add that we were in the midst of doing the university's system-wide, actually first ever system-wide strategic plan when all of this broke. It started beforehand, and we kept that work going because even though the work related specifically to this crisis absolutely fills the day without question, you also want to have your roadmap for what you're going to do afterwards. And so we decided to make sure that we continued on the work through with the strategic planning process. And it specifically reflects in addition to our commitment to students and to discovery and to equity and inclusion and to being good stewards of resources as a public institution, it reflects our commitment to serve the state at world-class levels. And we call that commitment MINtersections, the intersection between the unique challenges and opportunities posed by the state and our capacity to solve those challenges, amplify those opportunities at world-class levels. And the first MINtersection area is health. And health is a broad umbrella, of course. It includes research into cures. It includes how we train clinicians. It includes our work in med tech and discovery. And all of that together is largely motivated by, incentivized by, sort of catalyzed by, I'm looking for the right word, exactly what you just described, which is that if we can do this during this crisis, we need to be prepared to do this all the time, and certainly sometime, hopefully very long time down the road, if and when there is another crisis in the future. And a lot of that being inspired by exactly what you describe around our sense of community. So I just wanted to make sure that everyone listening understood that and had a sense of how this was affecting the thought around the university as a whole. Okay, I'm going to pivot and ask some lighter questions. So we received questions that asked, if you were not an infectious disease expert, what job would you have?
Well, I have known I've wanted to be a quote unquote disease detective since I was in junior high. I had a very unusual experience as a boy growing up in a small Iowa farm town where someone who subscribed to the New Yorker magazine there, I think the only person in all of Iowa back then that subscribed to the New Yorker, would share those copies with me and the stories called the Annals of Medicine, little vignettes by Burton Roget, whodunit stories that were medical detective stories. And I knew then I wanted to do this. The only time I came close to thinking about something else is I did have the opportunity in my junior and senior of college in Iowa to actually spend time in Florida and actually work with the manatee through the youth group at the University of Florida and the Jacques Cousteau group. And so I spent literally hours and hours a day diving in waters with manatee that became friends, much like your dog would become. And I thought maybe I should go into this, but the pull of infectious disease kept me coming back. So while I've had a world always connected with water, I think if I weren't in this area, I would probably be in oceanography of some kind, as my love for the water is just very, very real.
I actually feel the call to the water too. We'll talk about that probably at some point, hopefully face to face. So we were also asked, what do you want to do as soon as you can? So you talked about your grandkids and some of your family traditions, but what are some of the things that you sort of are holding out in front of you as your motivation for when we can do them again?
You know, I can't wait to wrestle with my grandkids, either indoors or outdoors. And I surely can't wait to take them to a Twins game. That is going to be a very, very special day for me. I live for that day. And I believe it's going to happen. And I believe I will cherish it unlike any other day I've ever had. So it's being with my kids and grandkids that mean everything.
Yeah, I'll at the risk of asking for another indulgence, I was asked the same question. I really think if I weren't the president of the university, I would still be back in the classroom, sort of like you, where I feel like I won the lottery professionally, being associated with higher education, and now especially being associated with this higher education institution. But for me, in addition to being with the people who I miss the most, I would travel again. I can't wait to travel again. So are you an international traveler? When you can get back on an airplane and you're not as worried about swapping that air, where would you go?
Well, first of all, this has been one of the culture shocks for me. You know, prior to March, I was flying about 200,000 air miles a year with all my international work. And I've not been in a plane since March. Instead, I've done about 200,000 hours on Zoom instead. But I have a real love of New Zealand. That's a place that's very special and near to my heart. The other place is Ireland. My mother, Abby Ryan, I still have those Irish genes that are deep inside of me. So I would go to either of those two islands, maybe and both, and spend the time there. But also, I just love being here at home. I love the fact of where I live. We have a place up in the Boundary Waters that is a very beautiful place. So I have a number of wonderful places to go to, and ironically, again, they involve water.
Imagine that. So as we start to wind down and we think about the things we look forward to, I want to give everybody some good news, just a little quick rundown of some of the things that have happened during this exact period of time. In addition to our own Dr. Mike Osterholm being on the president-elect's transition team, Scott Perunovich from Duluth won the Hobie Baker Award. Nabir Sarma won the College Jeopardy Championship. Paul Dowenauer and Damian Fair were awarded MacArthur Fellowships, also known as Genius Grants. One of those would be remarkable, and to have 2 in 1 year is really something. We surpassed $1 billion in research expenditures for the first time. We've increased our rankings in patents and NIH funding. We had a record-breaking year in private giving. Of course, we've had all the work related to the pandemic, particularly around vaccines and therapeutic developments. We were part of the state's testing protocol and really pushed the envelope nationally on testing capacity. This included an expansion into the mental health work that Mike described as being so critical, not only for our campus community, but through extension into the rural parts of the state. The College of Science and Engineering, in partnership with industry, invented the low-cost ventilators called the co-venters. We were part of the pandemic modeling through the School of Public Health. The value created for Minnesotans and for the University of Minnesota community has never been higher. So when we say we're proud to be a part of everything that everyone is doing, we really, really mean it. But in particular, Mike, we're incredibly proud of you and really grateful that you would join us in this way, our community listening from around the world. And we thank everyone listening for staying connected to this world-class university, for your insights, for your support. And as we look for silver linings and hang on and get through this COVID year, we really have come to realize that bringing the university together, relying on subject matter experts, but also on that sense of connectivity and our willingness to find it in all of the ways that we possibly can, is how we've been able to drive the semi through the needle. I'm totally stealing that phrase. That's one of the best things I've heard through this whole thing, and make this university something that lives up to its 170-year legacy, and that 170 years from now, people look at this as a pivot point and realize that we really did care about the core values and used those core values to achieve excellence. We will do that on your behalf, and that's our commitment to you as we work through this absolutely crazy time. But we look forward to your feedback and your ideas and your benchmarking and your insights, because that's how we continue to do this good work. So thank you all so very much for joining us. Thank you, Mike, for your time today and for being your fabulous self. Go Gophers.
Thank you.